folks. I'm very happy to be here today to talk with you about sleep and its importance to cognition. My name is Dr. Julie Suhr. I'm a professor and director of clinical training in the psychology department here at Ohio University. And I am also a psychologist who works in our psychology and social work training clinic, which is also located in the Department of Psychology at Ohio University. My area of study is neuropsychology, so I do work on brain and things that affect our brain and our brain functioning. And I've also done some work on sleep and how it is related to cognition. In our clinic, we also offer some services for individuals who have sleep difficulty, and I'll be talking about those at the very end of this presentation, so stay tuned. And I also want to acknowledge my sweet little grand kitty, Oscar, who is the featured visual during this slideshow. So let's get started. Why are we here to talk about sleep and cognition? Well, we know that sleep is very important to cognition, but at a larger level, sleep is just absolutely an essential function for human beings. It's essential to our body. Poor sleep is associated with immune function dysregulation. It's associated with changes to your stress hormone secretion. It's associated with your cardiovascular health. It's associated with changes to glucose metabolism. And so it's related to all the disorders that are related to poor immune functioning and poor stress hormones and poor cardiovascular health and poor glucose metabolism. So very essential to your body, but it's also essential to your mind in the sense that poor sleep is associated with increased symptoms of depression and anxiety, as well as depressive and anxiety disorders themselves. Sleep is also essential to our very lifespan. Many studies show that adults who get good quality sleep of 7 to 8 hours a night are those who live the longest. So it shouldn't surprise us that we spend a third of our lives asleep. There's very good reasons for it. In fact, sleep can really be thought of as a health variable that healthcare providers should be asking us about at every checkup and medical visit. So again, these factors show how sleep is related to the health of your body and also to your mental health. There are also a lot of studies that suggest sleep is even more important for your cognitive performance. That's what we're going to focus on today. Before we get started on that research, let's take a moment to think about the fact that sleep does change as we age. I'm only going to start at adulthood, since I know that I'm speaking to folks who are employed here at Ohio University, and many of us who are employed here at Ohio University spend our entire adulthood and our entire span of our adulthood careers here at Ohio University. And we do know from a lot of research over decades that kids sleep more than adults do. And though by the time we hit adolescence and into adulthood, generally 7 to 8 hours is considered sufficient sleep and adequate sleep for most people. There are people who are a little bit shorter sleepers than that. There are people who are a little bit longer sleepers than that. And then there are people with very short sleep and very long sleep. And we'll talk about that more a little bit later. But the general range that's good for most adults, at least young adults and into middle age, is 7 to 8 hours. However, as we grow older and get past our middle age into our upper years of age, there's a bit of a controversy in that we definitely get less sleep, but the controversy is whether we need less sleep and thus get less sleep, or whether we just get less sleep, but we still could benefit from having those full 7 to 8 hours. What we do know, however, is that as we get older, both the quantity of our overall sleep and the quantity of our most deepest stages of sleep, the sleep that is most restorative for your brain, decline. We get less of sleep overall and less of our deep restorative sleep. We also know from a lot of sleep research with adults as they age is that The older you get, the more often you are going to experience what is known as waking after sleep onset. And this is when you wake up partway through the night or way earlier than you want to get up and you can't get back to sleep. In addition, while this is kind of a stereotype of older adults, the idea that as you grow older, you'll have your dinner earlier and earlier and be in your pajamas earlier and earlier, and then be in bed by 8 o'clock and then get up really, really early. That stereotype is actually true. For many older adults, they experience what's called a phase shift in their circadian rhythms. So your circadian rhythms are your daily rhythms of being awake and alert and then being drowsy and sleepy and falling asleep. We all have daily rhythm patterns. And what happens as we grow older is we, in fact, do get sleepier earlier in the evenings than we used to when we were younger. And we wake up earlier and earlier. Now, there's nothing wrong with that schedule if it fits your lifestyle. But when you are somebody maybe who has young children and a need to be busy with your children and then maybe continue to do some work, or if you're a shift worker and working different kinds of patterns versus what your sleep cycle is, your daily life may interfere with what your particular circadian rhythms are telling you for when you should be asleep. And thus that can interfere with the quality and quantity of your sleep. And then we also know as we age, we start to notice a need to nap. And so we end up napping more. And that's not just because after retirement you have room to nap. There is some research that suggests that's the case. Many people, when they are in their working years, but as they're growing older in their working years, really find that they have an afternoon slump and that they feel like they need to take a nap to be productive. So all of these kinds of changes seem to be happening because of changes to our body and our brain as we grow older. And thus they affect not only the quantity of our sleep, but the quality of our sleep. Our sleep, instead of being nicely consolidated together in a nice 7 to 8 hour chunk that doesn't get interrupted so we can get to our deepest sleep stages, unfortunately gets kind of pulled apart. And so then our sleep we don't get into those deepest, most restorative stages of sleep. So let's move on to thinking about sleep effects on cognition. Now, as a researcher, I want to give you a sense of how do we study this? How do we know that sleep affects our cognition? Well, we can experimentally manipulate sleep. So there are research projects where the experimenters purposely deprive people of sleep. So they might keep you up for longer and longer periods, go past 24 hours, 48 hours, even longer periods of time. They might actually do what might be called a partial sleep deprivation, where you come into the lab to sleep and they hook you up to the monitors and the EEG so they can see what your sleep looks like, and they wake you up when you're in those deepest, most restorative stages of sleep. So you're getting some sleep, but you're not getting good quality deep sleep. We call that a partial deprivation kind of sleep study. In addition to experimentally manipulating people's sleep, there are lots of research projects that would be more observation or correlational in nature. And that would be when they survey people to ask about their sleep or have them keep sleep diaries or bring them into the lab and measure the quality of their sleep, and then just try to relate that to how they perform on cognitive tests. So we have lots of decades of research that look at both of those kinds of designs. And in general, we see kind of the same conclusions, whether or not we experimentally manipulate sleep or we're just observing people's sleep. And one of the big effects, which probably won't surprise you if you're somebody who doesn't always get the best sleep, is that poor sleep is associated with poor attention and vigilance in the next day after bad sleep, after sleep deprivation. And what I mean by that is when we need to pay attention to something, especially sustain our attention to something over a period of time, we want to be very careful and focus, and we don't want to make errors. And that the worse sleep we have, the more likely is we're going to make errors in a sustained attention task, especially as the task duration lengthens. And interestingly, that research also shows that this is especially true for tasks that are more routine. So things you might do in your everyday life, like if you're used to looking at spreadsheets and checking numbers and or coding or editing a document, for example, it's not demanding a really high level of concentration or requiring you to do complex decision making, might not be particularly engaging. It's kind of just something you have to do a lot in your job all day long. Then you find that those are even more affected. As an example, a friend of mine who I run with a lot mentioned to me just this morning. We run at 5 in the morning. Um, mentioned to me just this morning that she had had some difficulties with sleep for a couple of nights in a row, and then she was in a very long meeting where she had to present some financial information related to her job. And she mentioned to everyone that, if she made mistakes, please someone catch her, because she knew that her own attention and vigilance to making sure she was saying the right numbers at the right time as she explained things was likely to be impacted by a couple of nights of poor sleep. Another cognitive domain that is associated with poor sleep or lack of sleep, as in the sleep deprivation studies, is executive functioning. Now, executive functioning is a term we use for really higher order cognitive skills that are things like problem solving and planning. Executive function requires you to utilize all your underlying cognitive skills to kind of reach a goal, to form a goal. And there's a lot of different sub skills associated with executive functioning. What we see for sleep is that poor sleep has a detrimental effect on working memory. Working memory is when you're having to hold something in your attention span and manipulate it and use it actively and maybe make sure that other things don't creep into that working memory. And another domain that's affected by sleep deprivation or poor sleep quality is inhibition or impulsivity. So when people have poor sleep, they find that it is much more difficult for them to inhibit. They're getting distracted easily by external or internal things, and they're also more apt to act out on things that they're thinking. They're going to say them without inhibiting them. They're going to do things impulsively that they think of without inhibiting those behaviors. Those are very strongly related to sleep. Another domain that a lot of people feel like is affected by their sleep ability actually has really mixed findings, in that some studies show that individuals with poor sleep or who've been sleep deprived have poor memory, but other studies showing that it doesn't seem to affect memory. And one of the reasons for this seems to be that a very important part of memory is attention. If you don't pay attention to something, you're not going to remember it later. And also executive functioning. When we're trying to remember a very big, complicated thing, we often have to organize that memory. We have to use learning strategies to learn that information. And those tend to be executive function skills. We're going to come back to memory in a couple of slides because there's really good reasons from the brain perspective that sleep should be related to our ability to remember. A final cognitive domain that really is very strongly affected by sleep is that of reaction time. Again, some of you may have noticed this in your everyday life, that when we don't get good quality sleep, when we're sleep deprived, we are much slower to respond to things. And this includes simple things like reacting to a sound, reacting to a noise, pushing a button when you're given a signal to do so, and includes then our information processing speed, our decision-making reaction time as well, more complex reaction time. In general, when we get poor sleep, we're just a lot slower in our cognitive abilities. And that could also be a reason that you might notice everyday memory problems, because it's a lot harder for those gears in your brain to turn efficiently and learn something very efficiently. You might need to rehearse it a lot more before it's going to stay in your memory span because you're having slowed processing speed. Now, the studies that I mentioned to you are predominantly, especially the experimental manipulation ones, focused on getting too little sleep. So poor quality sleep, few hours of sleep, depriving you of sleep over a long period of time. But there are some observational studies suggesting that if you are a person who's really needing to sleep, well over the 7 to 8 hours, so you're needing to get 10, 12, 14 hours of sleep to feel rested at all, that can also be associated with poor cognition. And that's likely because of all of the other medical conditions that it might be related to. Now, I was talking on that last slide about some of the research on either experimentally manipulating sleep or observing people's sleep. And I should have noted that in those studies, those are studies of people who aren't experiencing the sleep disorder that's known as obstructive sleep apnea. Now, what is obstructive sleep apnea? Well, you might have obstructive sleep apnea if you, and I do have a cameo here of my grand dog Ollie, because he is likely experiencing obstructive sleep apnea in this picture. If you find that you snore loudly, particularly if other people who are in your home where you sleep are aware of your snoring, even with the door closed. If you don't feel rested when you wake up or even have a headache upon awakening, and this can be you felt like you got your 7 or 8 hours of sleep, but you wake up and you still don't feel rested or even have that headache. Or if you or a bed partner notice that you are kind of stopping breathing briefly at night and then snorting and sort of gasping, even if it doesn't wake you up, it's often the bed partner who notices you snorting and gasping and restarting your breathing multiple times at night. These are signs that you may have obstructive sleep apnea. And obstructive sleep apnea, the reason it's called obstructive is that what's happening is a partial or complete cessation of good airway flow to your lungs. This is a narrowing in your upper airway, and this might occur repeatedly during sleep. The number of times it occurs and the length of it and the degree to which it's blocking oxygenation is the severity of your obstructive sleep apnea. It occurs in about 2 to 5% of people, adults up through middle age. But as we grow older, and once you're around 60 or so, it's anywhere from 19 to 57% of individuals. So it is something that is more likely as you grow older, but it also tends to be seen more in individuals who have high blood pressure, who have a higher body mass index, who have larger necks, and who are men. And that's partly because it's your neck and the your body around your neck that can lead to this kind of passive blocking of your good airway flow. Again, it's associated with these symptoms and with excessive daytime sleepiness. So individuals who have obstructive sleep apnea, again, maybe went to bed at a good time, felt like they were getting 7 to 8 hours of sleep, and yet they simply are not rested. They're feeling sleepy all day long. It's also associated with mood swings and emotion regulation difficulties. It's also associated with cardiovascular risks because you're not getting adequate blood flow to your heart during the night. But it's also associated with cognition because you're not getting adequate blood flow, oxygenated blood up to your brain. Because your brain is a very small part of your body, but it's an oxygen hog. It really, really it takes about 20% of the oxygen in any particular beat of your heart, the oxygenated blood. So, not surprisingly, it is related to cognition. In particular, if it's untreated, it's related to problems with memory and working memory, executive function, psychomotor speed, and again, that attention vigilance. So these are a lot of the same domains I mentioned on the last slide. In fact, obstructive sleep apnea, if untreated, is also related to car accidents and workplace difficulties, workplace accidents, for the same reasons that poor sleep is. However, the added complication here, and the much more consistent findings with memory are because in obstructive sleep apnea, you're not getting oxygen to your brain. So I wanted to mention that, and particularly some risk factors, so that if you in fact have notice some of these risk factors. You'll stop sleeping like my grand dog Ollie. For many people, it is what we call postural, in that it's sort of the position you sleep in. For humans, as opposed to dogs, it's when you lay flat on your back, you're more likely to have it. But for some individuals, they have it, and again, it's their bed partners or other people in their home that are more aware of the symptoms than they are. Uh, and it is just something that can be treated. The most common treatment is continuous positive airway pressure, or what's called CPAP. This is not being on oxygen. It's actually the mask that goes over your face, and it's like blowing air to keep those airways open. Can be a very effective treatment. It is known to decrease those symptoms of excessive daytime sleepiness. It definitely lowers people's risk for workplace or car accidents or errors, and can improve cognitive functioning as well. But again, even outside of obstructive sleep apnea, poor sleep is associated with poor cognition. And why might that be? Well, as I mentioned at the beginning, I'm a neuropsychologist, and we really study brain behavior relationships. And there are certain things that seem to happen during sleep in our brains that are related to our cognitive performance. One of those, I mentioned a little bit ago that I was going to return to the idea of our memory. So your memory, you have to pay attention to something to learn something new, but then you actually have to rehearse it. Many things are in our attention and we use them actively in our working memory, and then we forget them later because we don't need to remember them. But many other things are things we need to learn. We need to learn new routines at work. We need to learn new skills. I need to learn the names of all of my students every year when classes start again. And in order to learn that new material and move it over to my long-term memory, I have to rehearse it. And that consolidation is a get together, wire together process that my brain has to do in order to learn that information. And what we have found from research is that it is our rapid eye movement sleep, or REM sleep. This is the sleep during which you dream, as well as other slow wave sleep, and in particular, a type of brain wave called the sleep spindles that seem to be crucial for consolidating that newly learned material. So how do we know that? Well, researchers have done studies where they ask people to learn new information in a particular day or in the evening before they go to sleep. And then they put them into the sleep lab and they hook them up so they can measure their brain waves. And if the sleep researcher wakes people up during REM or during slow wave sleep so that they aren't able to get that kind of sleep, they won't remember that material very well the next day. Whereas if they allow people to sleep normally, they get their REM sleep and their slow wave sleep, they're more likely to remember that material the next day, because their brain's been able to do that fire together, wire together process that helps you keep that memory. We also, in a different kind of study, see that when people are cognitively and physically active on a particular day, and then we bring them in and put them in the sleep lab and hook them up to the equipment, they will get an increased amount of slow wave sleep. It's as though their brain was saying, gosh, I need a lot more of that deep, slow wave restorative sleep to recover from this really cognitively and physically busy day, compared to a day when you aren't quite as busy. More importantly, when researchers have separated out being cognitively active, even if you weren't physically active, they've been able to show that it is the cognitive busyness that requires you to have an increase in your slow wave sleep to let your brain recover. In other words, sleep is for your brain and your thinking skills, and not so much for your body. Your body can rest in a lot of positions, but sleep and in a lot of ways. But sleep itself is for recovery of your brain during a cognitively active day. And a final set of studies is when we're able to look at where are brain cells in your brain active, where are they firing together, even at rest, when you're just thinking about the brain functioning. And we do techniques such as fMRI, if you've heard of that, which is sort of measuring where's the blood flowing to your brain, where's your brain active at a given time. And again, we see that in individuals who have poor sleep or who've been deprived of sleep, we see that there's not as good of functioning in several brain areas that are super important for that executive function component, as well as for just our alertness and arousal, that cortical thalamic network. So again, these are kind of the neurological explanations for why a poor night of sleep or a few nights of poor sleep might interfere with your next day cognitive functioning. However, there are other ways that cognition can be affected by poor sleep. And both of them you maybe have experienced if you've ever had times that you've had poor sleep and then tried to function the next day. We call both of them sleeping when unaware. One of them is microsleeps. We use that term when people are experiencing really transient loss of perception of external stimuli. So you suddenly really aren't attending to what's going on around you. They can last, they're often very, very brief. They can last up to 30 seconds, and they can occur at any time and any frequency. People typically are unaware when it's happening because they're typically much shorter than 30 seconds, where people are literally shifting into a state where they aren't aware. Of course, not surprisingly, these are very dangerous when your task that you're trying to do requires that you have constant attention or vigilance, such as driving, or even many jobs that we have that require that level of attention or vigilance. If you stop attending to the external stimuli, that could be dangerous. People often become aware that they seem to have lost their attention and try to compensate, but often they cannot prevent them, especially if they're very sleep deprived, because the brain is basically saying, I am sleep deprived, I'm in sleep debt, I'm going to slip into sleep at a moment that I'm trying to pay attention to something. Interestingly, we've done some research with undergraduate students who were good and poor sleepers. They kept sleep diaries, and we brought in the folks who were good sleepers and the folks who really slept less than 5 hours a night on average. Often this was their lifestyle, choosing to sleep that little. And they were folks who thought they had the disorder called attention deficit hyperactivity disorder because they felt like they weren't paying attention well. We hooked them up to an EEG so we could measure their brain waves, and we put them in a room where they had to listen to me give a really boring lecture about the eye. And what we saw is the individuals who were very poor sleepers were actually slipping into microsleeps quite often. We were in another room, and so we could put an alarm and ask if they were still taking notes, ask if they were still paying attention. They all thought they were kind of paying attention or that they had drifted a little bit in their attention. They did not think they were asleep. But we did find later that those who had a lot more microsleeps did worse on the test following the lecture and had not taken as good of notes. One of the other reasons they didn't take good notes is the other sleeping when unaware syndrome, which is semi-dreaming while you're actually engaged in tasks. So again, maybe some of you have been there. I know that I've experienced it, particularly if I go to a conference. I'm more apt to stay up and visit with friends that I don't see often, and then go to some early morning session. And I can be really interested in the topic, I really want to hear about it. And I'm taking notes, and I find that later I look at my notes and they're just gibberish. I can't even read what I wrote. And that was likely because I slipped into semi-dreaming where I was actually falling asleep. And again, people can sometimes do this when they're talking, often when they're writing and listening, but even when they're driving. And so this is a longer period of time where you're not aware of what's going on around you. So it can make you feel like you have poor cognition, poor attention, poor memory, but you're actually slipping into sleep because you have a sleep debt. You're not sleeping well. So in your everyday life, this may feel like cognition, but it should raise some alarms if you're noticing this happening. You're definitely getting poor sleep. Now, in both of these cases of the actual cognitive effects because of maybe changes in your brain or the fact that you're falling asleep during the day, we've been talking about poor sleep related to how you're doing right now in terms of your cognitive skills. But poor sleep may also be related for your risks for cognitive decline as you age. So, for example, your risks for dementia, cognition much more later in life, when you want to be retired and still have a great quality of life. Well, one reason for that is that one I mentioned right back at the beginning of our presentation. Poor sleep is related to inflammatory processes throughout the body and the brain. So individuals with poor sleep have increased risks for inflammatory related disorders such as obesity, diabetes, heart disease, and disorders like hypertension and diabetes and obesity and heart disease are also themselves related to cognitive impairment. But the inflammatory markers are also associated directly with cognitive impairment due to a direct effect of inflammation on the brain, what we call neuroinflammation. So poor sleep leads to neuroinflammation, which probably affects your cognition over time. In addition, some very exciting new research in the last 10 years or so, certainly much of it has been with animals, but now there are more human studies. We find that during the deepest stages of sleep, there's an increase in your cerebral spinal fluid production. So cerebral spinal fluid is a liquid, a kind of a saline-like liquid that is formed in your ventricles, which are kind of in the middle of your brain, and then flow through those ventricles and around your brain and into your spinal cord. We also see an increased blood flow to the brain during those deepest stages of sleep, those most restorative stages of sleep. So in effect, it is likely that during those deepest slow wave stages of sleep, your brain is cleansing itself. It's washing itself of toxins, and in particular, toxins that are related to Alzheimer's disease. So some very recent studies have confirmed that when you deprive adults of sleep, they will then have higher rates of tau protein and amyloid beta protein in their cerebrospinal fluid than when you allow them to sleep regularly. If those two types of proteins sound familiar to you, that is because those proteins have been related to the formation of Alzheimer's disease. So again, they monitored them when they slept normally, and then over 36 hours of sleep deprivation. And what it suggests is with that increase in these proteins in their cerebral spinal fluid, that there's a lack of flushing it out. So really important to get that deep restorative sleep to kind of cleanse the brain of those toxins that over time might increase risk for dementia. In fact, that is something that we see in research, that poor sleep quality, even in your middle-aged years, and of course in your older age, predicts cognitive decline later. Now, it is important to note that this association has been linked particularly with depression. So depression is related to poor sleep. Poor sleep can cause more depressive symptoms. Depression is related to cognitive decline. Depression is also related to neuroinflammation, as I mentioned before. And so it's kind of a chicken or egg. These are all related to each other. And while that makes it hard for those of us who want to find the causes, it also means there's lots of ways you can intervene. You can improve your depression or your anxiety. You could also work to improve your sleep quality, which might improve your cognition and your depressive symptoms and lower your risk for cognitive decline. We also see that the presence of sleep disorders is predictive of cognitive decline, even in people who already are showing signs of cognitive impairment. And just as a side note, as you grow older, dementia itself also causes dramatic changes in sleep. Sleep gets very highly fragmented, and people experience what is known as sundowning, where instead of getting sleepy in the evenings, they actually become more agitated and aroused at that time point. So again, chicken or egg relationship, but more importantly, these studies have shown that even in our middle-aged years, if we have poor sleep quality, it will predict our cognitive health later in life. So another really good reason to get better sleep. On that note, let's spend a couple of slides and the rest of our time talking about some things that you might be able to do to improve your sleep. Now, some of you may have even asked about sleep when you've gone for a checkup, a yearly checkup, or been to some kind of health fair, and you might have received some kind of sleep hygiene handout. Sleep hygiene is the word for the lifestyle behaviors and behavior management techniques that we can do to improve our sleep outside of getting an intervention of some sort. And many of those worksheets aren't fully complete. Hopefully, in the brief amount of time we have left, I can give you a little bit more detail about some of these techniques. But the big thing is that I want to remind us sleep is a 24-hour activity because it is on a circadian rhythm. It's a daily rhythm of ours to be alert and awake and aware, and then to have a period of time where we're less alert and we're not awake and we're sleeping and restoring our brain. So what we do during the entire 24-hour period can affect the quality of our sleep. So we really need to start with thinking about what do we do right away the first thing in the morning? And one piece of sleep hygiene that is strongly recommended is get up at the same time of day, no matter what. And with that one statement, I've probably lost half of you. We're like, oh, that's impossible. Because indeed, many of us have sort of our work week get up schedule and go to bed schedule, and then we have our weekend schedule. Most sleep experts and sleep clinicians will point out that when we say at the same time, no matter up, it doesn't mean exactly the same moment and always have your alarm set to exactly that same time. You can give yourself an hour window, maybe even an hour half window. But if you're somebody who gets up for work at 5 a.m. and then on the weekends tries to sleep till 11, you're really messing with that 24-hour sleep clock. And it's not only is Monday morning going to be really hard for you, but you're making it so that your sleep is less good quality by messing with that sleep clock. So try to set yourself a time that you get up no matter what. I mentioned earlier, I'm a 5 a.m. person. I grew up on a dairy farm. I used to get up at 4:30 a.m. So 5 is a luxury. And I often find on the weekends, even when I think that I want to sleep in, I can't sleep in past 6. My brain's going to wake me up. And I tell myself I really should get up because I want my Monday morning to be just fine, and I'm still sticking with my sleep schedule. As you go through the day, if you do feel a need for a nap, it is best to limit the daytime hours you spend sleeping to 30 minutes. No more than that. That can be restorative. If you're falling asleep on a dime, the second you try to take that 30-minute nap, you are sleep deprived and you need to sleep, but you don't want to sleep longer than that because you will then not be able to fall asleep in the evening, and that could be frustrating for you. It's always a good idea to try to get some exposure to natural daylight in the day. The reason for this is because sunlight is one of those things that helps to set your circadian rhythm, your daily rhythms. Sunlight is a cue to your brain that it is currently the time to be awake. Daylight comes through your eyes. Your eyes are actually part of your brain, a very direct part of your brain. And the eyes send those daylight signals, those light wavelengths right back to what is known as the suprachiasmatic nucleus. And this is your zeitgeber, your timekeeper. It's what's in charge of your natural melatonin release. And so it is a signal, oh, this is the time I should be awake and alert. So if you're feeling sleepy in the daytime, maybe instead of taking a nap, step outside and try to get some natural daylight exposure so that you can send that signal to your eyes that it's time to be awake. This one is tricky for people as they're working. It's part of the reason why I run at 5 a.m. And that is that it's best to exercise during the day and not too close to bedtime. So for many of us, this is very tricky. We work all day. We then also are often caring for family members, doing activities in the evening, and we can't fit in our exercise until very late in the day. The problem with that is that there are lots of other body functions that are on a 24-hour clock, just one of which is your temperature, but also your cardiovascular health, like your heart rate and your blood pressure. If you're exercising too close to bed, you're going to take your body temperature up, your heart rate's going to go up, and those are signals to your body and your brain that you're supposed to be awake and not asleep. So it's best to try to exercise not too close to bedtime if you can't. Again, I'm a 5 a.m. riser from a long time ago because once I had kids, I realized that was going to be my only time that I was going to be able to get things done and have my time for exercise. Stimulant use. So by stimulants, I mean anything that actually causes you to be more awake. So caffeine is the obvious one there, but nicotine also can fit into this category. And also, there are many over-the-counter and prescription medications that have a stimulant effect on you. It's best to try to avoid those too close to bedtime. You may find as you get older that you need to even avoid them more than that. So I'm a big lover of coffee. I love my caffeine, but I have to stop at noon. When I was younger, I could really drink it until 3 or 4 in the afternoon, and it wouldn't have an effect on me. But caffeine has a very long half-life, meaning it takes a long time for your body to metabolize it. So even 6 or 7 hours after you've had it, you still may have a lot of active caffeine in your system, and that may stop you from going to sleep. As you grow older, it becomes even harder to metabolize that away, which is why you might have to shift to stopping that caffeine use even earlier in your daytime schedule. If you are taking any sort of prescription that you think has that stimulant effect, or you know it's a side effect, please check with the prescribing physician to determine if you need to change the schedule and if it's okay to change your schedule. Don't just change your medication schedule on your own. Another thing you want to be caution about as we're now approaching the evening meal time of our day and thinking through that is you want to be careful with food and drink too close to bedtime. So, some people have snacks even after bed, and if those snacks or a big dinner that you eat too close to your bedtime triggers heartburn, or some reflux, then that's going to make it really hard for you to fall asleep because you're going to be irritated by it. And of course, if you drink too many liquids, you may find yourself needing to get up to use the bathroom a lot and then being able to fall back asleep. So now, once we get past our evening meal and we're really thinking, okay, it's time to go to bed, it's time to kind of, this is my relax and restoration thing, what can you do? Well, one thing you can do is establish a really regular, relaxing bedtime routine. Think transitions. It can be very, very healthy for you to have transitions to your day generally, like a transition to I am going to work, and a transition to I am on my way home from work, and now I am coming into my home environment, and that might be a transition that's both physical and also environmental. I'm changing my out of my work clothes into my relaxation clothes, and very mental. What do you do? I personally listen to really loud music if I'm in my car. If I ride my bike, I'm able to just really enjoy our bike path, but it's a transition home. Similarly, it can help you to then have a transition from, okay, it is time for me to get ready for bed. And that can include everything from I always listen to a certain kind of music, or I do some gentle yoga stretches. Again, not exercise, don't want to get that heart rate up. Or I have a routine for the order in which I do pajamas, teeth brushing, face washing, etc. That kind of can be, if you get into those kinds of habits, it's signaling to your body and brain, okay, we're in that mode of getting ready for bed. And that can help to condition you to be ready for bed. You also want to make sure your sleep environment is pleasant. It's surprising how many people have probably not bothered to change their mattress in a super long time, and I am one of those people as well. If you're not comfortable in your bed, then get a new mattress. Find one that actually is comfortable to you. But in addition, is your room a temperature that you really like? Is it too hot or is it too cold? Is it too quiet or too noisy? Would you like to have some kind of white noise or brown noise or pink noise and there are many different types of those that people find will help them with their sleep. Is there light in the room? There actually was a very recent study showing that even the slightest bit of light can be disruptive to getting into the deepest stages of sleep. So you might wear an eye mask if there's too much light coming in the room. And if you still want to have some sort of night lights to make sure you have a safe passage if you do get up in the middle of the night and need to check on a child or go to the bathroom, etc. Try to block that light out if you can. So again, make sure your sleep environment is pleasant and comfortable. Another big thing to think about, and this is another kind of way of conditioning yourself so that your brain and your body know that bed is for sleep, is that bed should be just for sleep, but nothing else. The sole other exception would be sexual activity. So don't read in your bed, don't watch TV in your bed, don't have arguments in your bed, don't talk on the phone in your bed. Certainly don't doom scroll on your phone in your bed or get out a tablet or a laptop and play games in your bed. Because then your brain and your body are telling you, oh, bed is where I do these things, as opposed to bed is where you sleep. So that is a conditioning that you can do. If you want to do those things, then get up and do them elsewhere. But I will point out, when you think about cell phones and computers and laptops and even some Kindles, that doing those outside of your bed, but in the evening, can also be problematic unless you're blocking the blue light. So things like computers and laptops, even many televisions, and even energy efficient bulbs that you might have in the lights in your living room, can, if they give off blue light, this is in the range of the electromagnetic spectrum that your eyes are going to interpret as daylight. And if your eyes are sending that light back to the suprachiasmatic nucleus again and signaling, oh, it's an alerting light signal, I'm going to delay the release of melatonin, it's going to keep you awake. So bed is for sleep, but if you're going to use electronics outside of your bed as part of your regular relaxing bedtime routine, then make sure you're using a blue light filter. Make sure that you're not using these energy efficient bulbs. You don't want to be sending your brain awake signals right when you want to be asleep. This next one is very hard too. It's probably the one that people have the most difficulty doing, and I know I do as well when I have some periods of time where I've developed insomnia. If you lay down and you cannot fall asleep, or if you wake up in the middle of the night and you cannot fall asleep in about half an hour, do not watch your clock. You get out of bed and you wait until you actually feel sleepy again, meaning you are falling asleep. Not that you're physically tired, that your body's tired, you're sleepy. You wait till you're sleepy to get back into bed and try to fall asleep again. Again, if you cannot fall back asleep, you get out and you repeat that as much as possible. When you get out of bed, you do something, again, that would be part of a regular relaxing bedtime routine, but you don't get back in that bed until you're sleepy. You want your brain to learn sleepiness is when I'm in my bed, so that you're more likely to fall asleep quickly. Do not, again, use an alarm clock to monitor how many minutes it's been. It's an estimate. Let your brain estimate it. Using markers like that can just make you frustrated and angry. And being frustrated and angry just sends your stress hormones way up, which is not conducive to sleep. I should point out here as well, many of you probably try to use your smartwatches to track your sleep. Just so that you know, as a side note, they are not accurate. They are at best gross estimators of the quality of your sleep. They're mostly based on movement. And some people move a lot even when they're still quite asleep. So I wouldn't trust them to judge the quality of your sleep. And also, if you look at it first thing in the morning and it suggests you got really bad sleep, you might just talk yourself into having a bad day because that's your expectancy now. You think you're going to expect to have bad sleep. Again, try to sleep the same hours every day of the week. There's no point in going to bed if you're not sleepy, but even if you stay up a little bit later, try to get up at that same time of day. Now, these kinds of pieces of sleep hygiene that I just mentioned on the last two slides can often really help people when they have a temporary difficulty with sleeping, or if they've gotten into some bad sleep habits and they're noticing that they're experiencing some daytime problems, and then they want to get a handle on it again. Like any behavior change, it can be hard to learn these new habits, but like developing an exercise routine or a new diet or stopping biting your fingernails, whatever new habit you're trying to develop, you can practice it, and over a few weeks, you will discover, okay, I'm getting better quality sleep now. However, for some people, if they're experiencing significant sleep difficulties, it might not be effective to just do these sleep hygiene techniques. When people experience interventions focused on sleep, the most common being CBTI, or cognitive behavioral therapy for insomnia, the very first step that the clinician will ask you to do is to try to fix your sleep hygiene. And then they will work on trying to make sure that you're able to do bed is for sleep and nothing else, and that you're doing stimulus control. research shows that that can be a very effective treatment for most forms of insomnia. And in fact, given that long-term use of sleep agents is contraindicated, it can be harmful. That includes prescription sleep medications and over-the-counter sleep medications. If you read the information about them, they are meant for only acute sleep problems. They are not meant to be taken chronically for sleep because they have a lot of problems associated with them. For many people, in fact, a lot of sleep agents have cognitive side effects. They make cognition worse. They also increase fall risk. So in the middle of the night, that might be a problem. So and some people use alcohol or marijuana as a sleep agent, also contraindicated. They do not help sleep. They might help you feel as though you can fall asleep quickly, but they're actually harmful to later stages of sleep. So you're not going to get the deep restorative sleep that you want. But a non-pharmacological treatment, cognitive behavioral therapy for insomnia, can be very effective. So if sleep hygiene is something that doesn't fix your sleep and you feel like you want to do a sleep consultation and learn about cognitive behavioral therapy for insomnia, the Ohio University Psychology and Social Work Clinic does offer this intervention in one of two formats. The first is a group virtual intervention. We developed this during COVID. It is billed at our clinic's group rate, which is $10 a session per participant. And there are 3 sessions, each 2 weeks apart. So it's $30 for the whole intervention. There's also a pre-treatment video session and helping you to start to keep track of a sleep diary. That one is free. And there's between session sleep tracking, either with the sleep diary on paper or also with an app if your phone is able to use the sleep app. Again, that's a group virtual intervention. So that's available to people who live anywhere in Ohio, but you have to live in Ohio to participate because our licensed clinicians are licensed to treat people only in Ohio. We also can offer a more extensive and individualized version of the cognitive behavioral therapy for insomnia as an individualized intervention. For that, we would need to bill your insurance, and you can contact us for either of these at 740-593-0902 to either sign up to be on the group wait list or to get more information about either the group or the individualized intervention. Our billing specialist could also check to make sure that your insurance would cover that if necessary for the individualized intervention in particular. So with that, I will stop this presentation and I will wish upon you the best sleep that you can get. Thank you.